Dr. Elena.
Katie, we're together for yet another episode. Welcome.
And indeed we are. Thank you for
I
time for me
f-
today. I'm very much enjoyed broadly speaking, we've been talking about the subject of sex, which has been very exciting, all these kinds of things. And what goes along with sex for many people, of course, is discussions about pregnancy prevention,
Mhm.
for which birth control, rhythm method, all these things are options. Um, now talked in previous episodes before about the use of birth control to mitigate negative menstrual symptoms and why, to your point, that simply masks symptoms that we should look to the root of instead so we can restore balance and improve overall health. One of my friend's favorite birth control methods, though, is the IUD. They love it. The friends I have who use it almost often use it because they've had terrible periods and they're done having kids. So it seems like this very elegant, perfect solution. And for some women, it absolutely might be the right thing. But I don't often hear them talk about potential negatives that go along with it. So I'm wondering if you can kind of give us your take on what you should know to have an informed decision about choosing to use an IUD or not.
Yes, absolutely. Contraception is a very broad subject. So hopefully, Katie, we can break it down in maybe a few episodes so it's not too
Oh,
overwhelming
sure.
for our audience. And maybe today we touch up on IUDs only. And then we talk about oral contraceptives on a future episode and maybe fertility awareness method on another episode. These are just suggestions, but stay tuned. Anyway, yes, you need to make informed decision. Ultimately, you're in the driving seat as a patient. You're in charge of your own body, and you need to be comfortable with the benefits and the consequences of a chosen method of contraception. Right. I always tell my patients this. They are in the driving seat. So as long as you know what is it that you could expect from a specific choice for contraception and you're willing to live with that, then it's perfectly okay.
Great.
So IUDs, there are two different types. There's the copper IUD, and then there is the hormonal IUD. Copper IUD will provide that physical barrier. Once it's placed in the uterine cavity, it provides an inflammation process. It's made of copper. So it works by still causing some hormonal imbalance secondary to the inflammation that it's causing locally inside the uterine tissue. However, it is not hormonal, so it does not contain any kind of synthetic hormones that will further disrupt your hormone balance. It does disrupt it to a certain degree because of that inflammation. And remember that, or maybe don't remember, just know that inflammation is at the core of all diseases. So inflammation somewhere can trigger inflammation somewhere else simply because the inflammatory cascade is triggered. But it is the least of evils, let's call it that way, of the choices for IUDs. So, women who have excessive bleeding, recurrent bleeds, long bleeds, menometrorrhagia in medical terminology, unfortunately, they go to their gynecologist with these presenting symptoms, and right away they're put on what options do they have, oral contraceptive or an IUD. But all of those will disrupt the hormonal balance. So if they choose to have, actually, their symptoms are a reflection of hormone balance to begin with. Okay, that means that they're estrogen dominant, progesterone deficient. We have talked about this. We kind of touched up on that. I can say it one more time for those who maybe have not listened to that particular episode. Estrogen dominance is really coined very smartly. It does not mean estrogen excess. It doesn't mean estrogen insufficiency. So it is not related to a high or a low level of estrogen. It reflects an estrogen level that is not well balanced by progesterone. So when progesterone starts declining, and that naturally happens gradually, starting from around the age of 35, or if a woman has an anovulatory cycle on a particular cycle, meaning she has not ovulated, she did not get that 60% progesterone production derived from the ovaries that month. the women will be at effects of estrogen levels that are not well balanced by progesterone. So that will result in heavy bleeds. Heavy bleeds will result in loss of iron. The woman will feel extremely tired, fatigued, worn out, drained, because you're losing blood, you're losing volume, you're losing your electrolytes, you're not maybe keeping up with hydration, and water alone is not able to replenish everything, and you're losing your iron. And on top of that, maybe 2 to 3 weeks later, you're going to start bleeding again because you don't have that progesterone support to stabilize the uterine lining. So it further compounds the blood loss, the volume loss, the feeling lethargic, worn out. So they go to their GYN and they get this option. They can do the copper IUD. Great. They put the copper IUD. Some women may experience bleeding with the implantation of the IUD itself. Others will not have that particular symptom, and they will do fine. They will complain of nothing. They will feel just great. The other ones who get the IUD that is hormonal, which is progestin. Progestin is a synthetic wannabe of progesterone, but it's not progesterone. So it has exactly the opposite effects of progesterone. And that will interfere with your hormonal balance and will block ovulation. So therefore, the woman with marine IUD, for example, that has a progestin synthetic analog in there, will prevent them from having bleeding. So they will not have a menstrual period, which is great for many women. A lot of women don't like being on their periods, but this comes with its own set of side effects. So let me share a little bit my screen so you see what I'm talking about. What are the differences between progesterone and progestin? Am I able to minimize this? Right. So the difference is in their biochemical structure. At the attachment site onto the progesterone receptors, both progesterone and progestin look exactly the same. So the receptor will be very sensitive and allow each of these to attach, unbeknown to the receptor that it's not really progesterone when the progestin attaches. What sets them apart is the opposite conformational difference between progesterone and progestin. But progestin is a synthetic analog. It is different on its affinity onto the receptor, even though it will attach onto the same receptor, but it will convey different signaling actions at the cellular and tissue level.
Oh my
It
God.
is a contraceptive, so blocks the ovulation. It does not support the pregnancy. It increases the breast cancer risk by 26%. Women need to know this. Whether progestin is included in an oral contraceptive combined with estrogen, or the mini pill, which is just progestin, or Mirena IUD, which is progestin only, it does increase the risk for breast cancer by 26%. Why? Because it allows the women to be on that estrogen dominance, meaning that estrogen will not be properly opposed by progesterone. Progestins also increase the risk for Alzheimer's by 100%. It's a whopping amount, right? It increases the risk for heart attacks by 28%. It increases the risk for mood disorders. So a lot of women will be displaying symptoms of estrogen dominance, irritability, anxiety, panic attacks, just not being able to control their moods because it is way beyond their control. And they will have, well, if they're on IUD, not necessarily, but they could have breakthrough bleeds. They will impact their they will cause sleep disturbances, so they will not be able to sleep well, and they will not be able to calm down on the drop of a hat. So
Holy moly.
adverse coronary function as well, as opposed to progesterone, which supports pregnancy, supports mood, because through a certain metabolite affects the GABA receptors. It's beneficial for the heart health. It stabilizes that uterine lining. It has anti-estrogenic effects and decreases the effects of estrogen stimulatory effects on the breast. So it is prevention. It's your breast cancer angel, so to speak. Okay, so as long as women are aware of these side effects, then they can make their own decision as to whether they want to consider any form of IUD, hormonal, progestin only, or copper, in considerations for preventing pregnancy, or if pregnancy is not a concern, maybe it is just to stop their bleeds. So to speak from clinical experience, I have women that have placed copper IUDs in and they did wonderful, and others that had such inflammatory response that they actually had to have it removed. The inflammatory response is compounding the effects of immune response in the body, and further down the line could result in autoimmune conditions. Obviously not in everybody, but there is a select few that this has this kind of effect. Others
Wow.
that had Mirena IUDs placed in and they bled for a few months before they actually lost their periods. And while they lost their periods, which is a normal consequence to implantation of a Mirena progestin only IUD, they were feeling the effects of estrogen dominance. Horribly irritable, anxious, ready to pick up a fight at the drop of a hat, very tearful because progesterone stabilizes the mood and prevents that tearfulness. So they could cry at the Kleenex commercial and they have no idea why they're crying. It just comes down and they cannot stop themselves. Also, decreased libido because progestins block the effects of androgens on the body because that's what kind of stimulates ovulation. So they don't have a great sexual life, sexual intimacy. It's harder for them to achieve orgasm, but it prevents pregnancy because it blocks the ovulation. So you have to be aware and put in balance, what is it that you're trying to achieve? Is contraception so very important at the detriment of your symptoms? Or is it that you could blend these and maybe adopt a more natural method like fertility awareness method in achieving contraception? And I don't
And
really want to throw it out there, but you know that there was a clinical study started on this idea of introducing a contraception method for males. And guess what? They got a headache and they stopped the clinical trial.
I
Ladies, a
have heard
headache.
this. I thought this was an urban legend. I heard this
No,
several years ago. This happened. This is true.
it is true. It is true. So
Good
if headache
Lord.
stopped a contraceptive for males, why are we accepting status quo of so many side effects from these synthetic medications simply to block pregnancy? Yes, there are natural fertility awareness methods out there, and you can follow different things or all together, but it takes some time to get used to and understanding the signs and symptoms that your body is throwing at you and how to interpret those. Sure, it takes about the average of 3 to 4 months to understand your cycle and what is it that you're experiencing vaginally, which each cycle, to understand where you are in your fertility days. We can talk about this when we talk directly about fertility awareness method. A lot of women are under the erroneous impression that you're fertile the entire month. You're not.
Mm.
So planning for that, you will have almost equal percentage positive effects on contraception. So fertility awareness method, 97.4% achieved contraception compared to 99.9% with an IUD or an oral contraceptive. I have a friend who's in Colorado. Both her and her sister were conceived while her mother was on oral birth control.
Oh my goodness.
Okay, so she said 0.1%, both of them, both sisters, she and her
Wow.
sister were conceived like this. This is true story. If Nicole is able to
Oh
connect
my
and, confirm the
gosh.
story, so it does happen.
I have a friend who got pregnant while she had an IUD in.
Yeah.
So that's fascinating. And I think you covered very well the pros and cons of using an IUD for birth control. And I guess I would just point our viewers to previous videos where we talk about the reason why masking symptoms that you experience during your periods ultimately can be counterproductive.
Yes.
Respecting, of course, the implications of having bad periods and the months it takes to figure it out can have very debilitating impacts on someone's daily life. So all these strategies are very understandable, particularly in an ecosystem where women are given bad information or no information about why they're experiencing symptoms that they're experiencing. We're here to give women actual information that they should have been getting all along. And I want to make a plug for my husband, who, God bless him, after like maybe 3 months after my baby was born, he said, you know what? You've been doing birth control the whole time. You had the baby. I'm going to get a vasectomy. It's fair. I said, you know what? That is fair. And so he did, right? So we can do a lot as loving couples by engaging men into the birth control conversation.
Absolutely. It takes two to have a baby, right?
Sure does.
So both
Sure
parties need to
does.
be involved, and open communication goes a long way. Absolutely.
Yeah. Now, Dr. Elena, before we wrap up, someone watching this may currently have an IUD in, or may have just gotten it out, and might be quite concerned about the fact that you said they're at increased risk of breast cancer and Alzheimer's. So if that is the case, whether it's this video or the next video, do you have any strategies that you recommend them to use to kind of have screenings done, or particular nutritious strategies they can employ to try to counterbalance what they've done or what's happened in their bodies? Can you speak to that at all?
Sure, that's another broad subject as well, but it's
Okay.
very individualized. So a lot of women
Oh.
will maybe not have an ovulatory cycle after removal of IUD or stopping the oral contraceptives for many months to come. Others will be just lucky and maybe get pregnant the next month, especially the ones that stop the IUD or the oral contraceptive with the purpose of getting pregnant and start building a family. But it is all individual. I have patients who have not ovulated for 6 to 12 months after removal of IUD. I have others who are bleeding out for 3 months after removal of IUD, which, you know, nobody prepares you that this is a normal physiological response to a removal of IUD. Not every woman will experience this, but there are many cases, and this is a natural occurrence. So restoring that hormone balance definitely is my main focus. And we go after everything, the stress, the nutritional component. I always stress the fact or emphasize the fact that nutrition only works if you absorb it. So we always go back to that, you know, gut health and everything, but detoxing that estrogen, detoxing the hormone receptors, because if they've been clogged up by these synthetic medications, they're confused as to when to respond and to what. And well, now that we're bringing progesterone in the system, is the progesterone receptors ready to be receptive to progesterone being introduced, or is it confused and still blocked by the effects of progestin? So it has to be an individualized basis. We have to look at every woman as a unique case. But fiber in your diet, you can never go wrong. It helps bind, detoxify those estrogens. Hydration, bowel movement especially is very important. Nobody likes to talk about poop. Have we posted that yet? Probably not.
Oh, I don't know, but I did
yes.
record myself unpacking my poop test, and it was
Yay.
very, very
Oh,
fun.
how
Yeah.
come I didn't see that?
I haven't posted it
That was
yet.
a
I should.
milestone, Katie.
You know, it
But
was.
yes, those who are already my patients, they know that I feel very comfortable to talk about bowel movements. You need to have at least one bowel movement a day. And this is what we work with from the very beginning, working our way backwards. Bowel movement, making sure methylation, liver detoxing works well, and then introducing things that are able to detoxify the estrogens and bringing adequate levels of progesterone, or stimulating your own progesterone production, improving, stimulating the occurrence of that ovulation. So you have ovarian derived progesterone. Yeah, the
We have
topic
been,
is broad.
it's true. We've not been afraid of hitting those heavy subjects today. This has been great.
Oh, by the way,
Mm.
I have some patients who actually improved their sexual life simply by removing the IUD,
Oh,
because the IUD has that effect on blocking the androgens. So we actually didn't have to do anything to stimulate her libido because it naturally came back, which is a
Oh,
normal benefit to
yay.
removing the IUD. But I'm not pro and I'm not con. I'm just here to inform you of
Yes.
what is it that you could expect, what symptoms may be associated with IUD use, and then you make your decision.
Oh, I love this. Well, thank you again for another great episode, great session.
Thank you, Katie.
And yeah, if there's any questions from viewers, you can comment below or send us emails, messages. We'll answer all of them.
Look forward to receiving them.
Awesome.
On
Thank
to
you,
the
Dr.
next
Elena.
episode. Bye,
Yes,
Katie.
bye.